gluteus minimus is a very, very important muscle when it comes to pelvic stabilization, and the problem, once again, is that it's going to be very, very time and weak in a lot of people. And when that happens, you can develop low back pain, hip pain, knee pain, also postural dysfunction and gait dysfunction. So you would want to correct that as soon as possible. With regard Hey everyone, Steven here from Team Euphoric, and this week's YouTube shorts are dedicated to the gluteus minimus muscle. And as with the gluteus medius muscle, the gluteus minimus is a very, very important muscle when it comes to pelvic stabilization. And the problem, once again, is that it's going to be very, very time and weak in a lot of people. And when that happens, you can develop low back pain, hip pain, knee pain, also postural dysfunction and gait dysfunction. So you would want to correct that as soon as possible. With regard to the gait dysfunction, if you recall from last week, one of the types of gait dysfunction that can arise is a Trendelenburg gait pattern. What that means is when you are on the weight-bearing limb, the contralateral pelvis is going to drop because of the weak gluteus minimus muscle. So you would want to do some strengthening exercises for the gluteus minimus. As with the gluteus medius, we're only covering two bones, and that's going to be the pelvis and the thigh bone. With regard to the pelvis, this right over here is your ilium, and on the superior aspect of the ilium, this right over here is going to be your iliac crest, and just inferior to that, we have the posterior gluteal line. Inferior and anterior to that, we have the anterior gluteal line, and that's pretty much it for the bony landmarks of the pelvis. And then we have the femur. At the femur, that's your thigh bone. This lateral protrusion right over here is referred to as the greater trochanter, and those are pretty much the most important bony landmarks when discussing the gluteus minimus muscle. The gluteus minimus inserts just inferior to the gluteus medius muscle between the posterior and anterior gluteal lines, and then it inserts into the greater trochanter of the femur on the anterior surface of the greater trochanter of the femur. And because it crosses both the pelvis and femur, we know it's going to have actions in both of those areas. They're going to be identical to the gluteus medius. At the pelvis, it's going to be responsible for ipsilateral depression, so depression of the same side, and then the posterior fibers, because they cross the joint line posteriorly, they're going to be responsible for retroversion or posteriorly tilting the pelvis, and then contralateral rotation, so rotation to the opposite side. The anterior fibers, because they cross the joint line anteriorly, they're going to be responsible for anteversion of the pelvis or anteriorly tilting the pelvis, and also ipsilateral rotation, so rotation to the same side. At the femur, they're all going to be responsible for abduction, but the anterior fibers are going to be responsible for both flexion and medial rotation, and then the posterior fibers are going to be responsible for both extension and lateral rotation. And that's pretty much it in terms of the actions. The gluteus minimus muscle is going to be innervated by the superior gluteal nerve, or your L4, L5, S1 nerve roots. And I'm just going to remove the sacrum so you can go ahead and see it. These right over here are your nerves. There's your L4, L5, and S1 nerve roots. And the reason this is going to be very, very important is because if you have any type of dysfunction to the nerve, like either some type of damage or some type of compression, that can shut off function to the gluteus minimus muscle. So you would want to do something to create some space and improve function of the nerve roots. What we can do is some ELDOA exercises. And on Sunday, I'm going to be taking you through the L4, L5, and L5, S1 ELDOA to improve the function of those nerve roots and improve the function of the gluteus minimus muscle. I'm going to be taking you through some strengthening exercises for the superficial fibers of the gluteus minimus muscle. I'm going to be taking you through two different variations, each of which you want to be in a sideline position for. This first one is going to be for the inferior and anterior fibers. What you want to do is take your arm rested underneath your head, the bottom leg, you're going to flex your hip and knee to 90 degrees with the top leg. You want to place a yoga block underneath your knee so that your knee is in line with your hip, and then you want to flex the knee to 90 degrees. At the ankle, you want to go into eversion, and then what we're going to do for this one is go into medial rotation of the femur by bringing your ankle up toward the sky. Next, if we want to target the superior and posterior fibers, all we're going to do is extend this leg a little bit and then flex the top leg to 90 degrees. Exact same thing though. What we're going to do is place the yoga block underneath the ankle. We're going to go into eversion, and then all we're going to do is go into medial rotation of the femur. And those are the two strengthening exercises for the gluteus minimus muscle, specifically the superficial fibers. Today I'm going to be demonstrating some myofascial stretching exercises for the gluteus minimus muscle, and I'm going to be taking you through two different variations, each of which you want to be sitting on the ground with your ischial tuberosities pressing down into the ground. Ideally, you want to do this on solid ground. If you're like me and you lack flexibility, you can't prop yourself up on a yoga block. You want to take the non-working limb and you're going to project your knee out to the side. You want 90 degree at the ankle, 90 degree at the knee. With the working leg, you want the knee in line with the hip, and again, you want 90 degree at the ankle, 90 degree at the knee. What you want to do is retroversion of the pelvis, flat lumbar, flat thoracic, chin tucked in, crown of the head up, eyes looking down forward to put the dura mater in tension with the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, project your palms forward. If we want to target the anterior fibers, we want to prioritize the pushing of the ischial tuberosities down into the ground. And then if we want to target the posterior fibers, what we want to do is go into anteversion of the pelvis by projecting the umbilicus forward, and then prioritize the pushing of the knee down into the ground. But those are the two myofascial stretching exercises for the gluteus minimus muscle. Today I'm going to be taking you through some ELDOA exercises for the Gluteus Minimus Muscle, and this first one's going to be the L5-S1 ELDOA. For it, you're laying in a supine position, you want your butt right up against the wall, and you want your heels in line with the ischial tuberosity, so one fist width apart. Maximum extension knees at the ankles, pseudo inversion, so dorsiflexion, inversion, then go into medial rotation without letting the toes touch. You want retroversion of the pelvis, flat lumbar, flat thoracic, chin tucked in, crown of the head away, as looking down between the thighs to put the dura mater in retention with the arms. Maximum extension of elbow and wrist, maximum external rotation, flex the shoulders to the level of the coronal plane, into the wall with the coccyx, away with the crown of the head and the palms, up with the heels, down with the sacrum, and that is the L5-S1 ELDOA. Next, the L4-L5 ELDOA. For this one, you're in a seated position, heels in line with the ischial tuberosity, so one fist width apart. You're going to flex your knees to 90 degrees, E version of ankles, press your knees down toward the ground, retroversion of pelvis, flat lumbar, flat thoracic, chin tucked in, crown of the head up, eyes looking down at the floor to put the dura mater in retention with the arms, maximum extension of elbow and wrist, maximum external rotation, flex shoulders to the level of the coronal plane, so biceps in line with the ear, up with the palms, up with the crown of the head, and that is the L4-L5 ELDOA.